Did you know that shin splints respond extremely well to chiropractic rehabilitative care? Let's talk about that. Shin splints are usually an inflammation and tendinitis of one of two muscle groups. The anterior shin muscles in through here, okay, which runs along the front of the foot, or the posterior, the back of the shin muscles, which occur back in through here, which come along to the bottom of the foot. Regardless, they can be quite painful, and for runners and athletes, it can shut them down. So what do you need to do? Like anything else, it's an accurate diagnosis. We need to confirm that it's a tendinitis of the shins and an inflammation. It isn't a stress fracture, it isn't something else. Sometimes it's a problem with the foot or the knee or the hip. Those areas need to be adjusted to give you proper mechanics. A lot of times the foot's collapsing, and that'll be putting pressure on the posterior tibial. If it's in the front, it's the pull-up of the foot that these muscles, the snowshoers, get that problem where they're pulling up all the time. So we have the accurate diagnosis. First, we have to shut down the inflammation with some therapy, some ice and some stim. But then we have to restore the length, the compliance, and the strength to the tissues. They need to be lengthened and strengthened. To lengthen them, we use a procedure called instrument-assisted myofascial release, Graston, where I get an instrument and we work on the muscles to lengthen them. Takes a few, and we take a little time. Now, sometimes we do it passively, sometimes we do it actively. Bring your foot up, flex the foot up and down and up and down. And if we add more resistance, it becomes a procedure called factor, which works extremely well. We're lengthening and we're driving blood to the tissues. Relax. For the posterior tib, it's the same thing. We just have to get up underneath the posterior or the back of the shin bone so we can get some authority up on the muscle and track it all the way down to its attachment. So myofascial release, Graston, factor are very, very important. However, that's going to lengthen and loosen the tissues. It's not going to strengthen. Then we have to go into strengthening. One of the best ways to strengthen these muscles are to do some toe raises with some resistance, with a stretch band in through here, pulling up, and we can do some resistance exercises that way. To do some resistance exercises for the posterior tib, you hold your foot in and then it pulls up. So you push down with resistance that way for posterior tibial strengthening. So you need to strengthen those areas. On top of that, if you're having shin splints, you need to do myofascial release at home. And to do that, you're either going to need an intracell stick or you're going to need a foam roller to break down the knots. So the Graston, the myofascial release in the office is essential, and then you myofascial release at home. And we finish it off with a little bit of support taping. I'll demonstrate the support taping for the posterior tibial muscle with some kinesio tape. Take a nice piece of kinesio tape, flex the foot up, bring it out, put a little stretch on the muscle, and we just want to support that muscle to give it a little bit of protection as it's healing. So you come right down the shin along to the bottom of the foot. Okay? So it's the integrative approach to treating shin splints that works. Adjustments for the mechanical imbalances, myofascial release to lengthen the tight, stiff muscles, home myofascial release to rehabilitate it, strengthening of the anterior and posterior tibial muscles, keeping those calves stretched out. That's where the intracell stick and foam roller come in as well, and kinesio taping to give you that little extra support. That's how you beat shin splints from a chiropractic perspective. Now you know.